Today's lecture will be on patient safety, both as an individual treating clinician and as safety throughout an entire health system. Please review the objectives for this lecture. Patient care can be delivered in three different methods. The first, interdisciplinary, would be that there is a team involved in the patient's care. A lot of times this is seen in inpatient rehab setting, where you're going to have a physical therapist assistant, OT, CODA, as well as speech, maybe therapeutic rec, the physician, nurse, PA. So they all work together for this patient's care, and they usually meet weekly to discuss the patient's progression. Also, we can see interdisciplinary treatment maybe in a pain clinic that might even have a psychologist involved, PTA130 physician. The next method would be a co-treatment. This is when a lot of times we'll see it as a physical therapist or PTA treating with occupational therapy. So it's a patient that requires another set of hands, usually a more challenging or affected patient that would benefit from having the two disciplines work together. Or we can be an individual care provider, and this is where we often will see in outpatient clinics where they are coming just to receive physical therapy. There are some reimbursement considerations, especially with a co-treatment. So if you are working with a CODA or occupational therapy assistant, and you guys are working with the patient for an hour, you both cannot charge the patient for an hour. That will be double charging. So often what happens is that each of you will charge for 30 minutes. One of the first steps for patient safety is actually orienting the patient. When you meet the patient for the first time, you want to make sure that you identify who you are and what discipline you are coming from, so that they have a good understanding of that. A lot of times in a hospital setting, the different disciplines will wear different color scrubs to help the patient identify as well. And as you've already learned, we need to ask for patient identifiers. We need to ask for their full name and their date of birth so that we can verify that we actually have the correct patient. This could cause a big safety issue. A lot of times in the hospital, patients can change rooms, and if you aren't verifying this and you did your chart review earlier in the morning and then they changed rooms, you could go into a patient who is not the patient you were expecting. And maybe this new patient has a weight-bearing status that they can't fully stand on their feet, and then you aren't aware of this. So it is very, very important that we make sure we verify that we have the right patient. We also want to, see what their current status is. You will be seeing them after the physical therapist has completed the evaluation, but a lot can change between that time period. So it's really important for you to verify how they're feeling. Are they in more pain? Anything that's changed. Maybe they're at home and they had a fall. Those are all things for you to identify. And then when you start treating them, you want to give them a plan for the treatment session. You want to know what goals you're working towards for that day and what treatment intervention you are going to do to address the impairments that they have. And if it's something that's new to them, discuss the benefits, or if there would be any risk for that treatment, allowing them to be aware of what that is. And then also allowing them to ask questions. You always want to, before you begin a treatment, say, do you have any questions? You also, as that beginning, orienting yourself to the patient, you really want to be observing the patient. Obviously, you're listening to what they're saying, but you want to look at their posture, their facial expressions, anything else that can lead you to maybe how they're feeling just by doing an observation. As stated on the previous slide, the patient identifiers that are used are full name and date of birth. This is also a requirement of the Joint Commission. The Joint Commission is an agency that provides accreditation for hospital systems. So they have designated that name and date of birth is what should be used to identify the patient to prevent medical errors. In addition, if the patient is in the hospital system, they must have a wristband on that also provides these patient identifiers. This is especially important if the patient is unable to communicate. In addition, some, especially outpatient facilities, may have individual policies where they require the patient to bring in a photo ID as well before treatment is initiated. We discussed during the documentation lecture HIPAA, which is the Health Insurance Portability and Accountability Act. And what is often required at the initiation of treatment is a signature of the patient, which states their agreement for you to share their electronic medical record with other healthcare providers who would need the information. HIPAA also ensures the safety or the protection of their personal health information. It is on a need-to-know basis in accessing patient records. Also, talking about informed consent, that it's important for us and legally that we need to provide information to our patients before beginning a new treatment or procedure. We have to let them know about what is the new procedure and if there are any risks involved, what are the benefits involved, is there any increased risk if they don't have the treatment performed, and are there any alternative treatments to this treatment. It often requires a signature of the patient and maybe as the PT as well. Now this isn't going to be required for putting on a cold pack, but maybe for dry needling where you're going to penetrate the skin. Definitely informed consents are used anytime a surgeon is going to perform surgery. But when there's a new treatment where there would be risk involved, we have to require a signature that the patient is okay with that. Now for you, if you are going to now include fluidotherapy into your patient's treatment, it's important for them to know what the treatment is, have an understanding, have the ability to ask questions, and also choose not to have it done if they're uncomfortable with the situation. You probably will not need to have a signature stating that, but still that same underlying principle of informed consent. Informed consent will be gained by the physical therapist on the day of the initial evaluation of the patient. But as I stated previously, anytime there is a new procedure added, it's important for that patient to provide informed consent, meaning you have described what the modality or what the treatment intervention is, any risks or benefits, allowing them to ask questions and make a decision. A good way to keep in process of doing this is to review the plan and the goals with the patient before treatment begins. This keeps them involved. It helps to increase compliance because they have an understanding as to why the treatment intervention is being performed, and it also helps to gain a rapport or trust. And don't we as adults like to know why? Why is this being done? And so it's the same with our patients. In addition to providing information to our patients during the orientation of the treatment, it provides you as a clinician information about the patient. And it's actually where we start to begin our documentation process. We observe our patients. It gives us information to put in their subjective section of their note. It allows them to ask questions and help guide the treatment, to help you know that if they don't understand something or having a misconception of what you are stating. Again, you want to observe their posture. Do they look like they're in pain? Their body mechanics. Their also facial expressions can tell you a lot about pain. And then you want to observe if they're being compliant. A lot of times this will be, are they maintaining their weight-bearing status? If they are non-weight-bearing and you happen to observe them coming in from the parking lot, not using their crutch or their cane as directed, it's a sign for you. And you can document that in your note because it is an observation of what you saw. Patient safety is our primary concern when we are in the clinic or the hospital or wherever we're doing patient care. Can you think of any possible risks to patient safety when you're in the clinic? Anything that you've learned thus far? Well, remember how we do temperature checks for the paraffin as well as the hot pack machine? That's a prevention of any potential burns for our patient. We want to make sure that we plan and we prevent. So maybe setting up the treatment intervention, if it's somebody who requires assistance with mobility, to not have any obstacles in the way, so there's not a potential for fall. Or if we know they're not going to be able to ambulate far, having a chair or a destination pre-planned so that they will arrive there safely. Here are some patient safety factors that we will run into daily when we're in the clinic. First one is hand washing. It's going to be so important for you to wash your hands many times throughout the day. Can even be during a treatment session, just to prevent the spread of infection. We also use gait belts, which we put around our patients so that we can hold on to them during mobility transfers or ambulation, and it's so that to prevent a fall. Trip hazards, as I mentioned in the previous slide, making sure that our treatment area is free from any obstacles that our patient could trip or fall over. Having the equipment calibrated. This is something that I have done every August for the equipment that we use at Fayetteville Tech. But this will need to be also done in the clinic to make sure that the equipment is functioning properly. And then it will be somebody's role in the clinic to do temperature checks on specific modalities to make sure that they are maintained at a safe temperature. Here are some potential risks for injury of our patients. Again, preventing falls. So whether it's obstacles in the way to be removed, if there's been a spill on the floor, that's now slippery, or if the patient is not having proper footwear, which could cause them to slip on a smooth tile surface. Are you using a gait belt? Skin tears, especially these are patients who have real fragile skin. It can happen really easily during a transfer or even bed mobility where there are shear forces that can cause a tear in their skin, or bumping their arm or their leg on the wheelchair. And this would cause you to write something up if you cause a skin tear on your patient, meaning a report that needs to be filed. You can also have burns from the patient, whether it's an electrical burn from using electrical stimulation or from either thermal or cryotherapy. And that is why we go back and we check on our patients within that 5 to 7 minute range. We also, and you'll be learning this semester in PTA110, how to monitor vitals. And so being quite aware of your patient and being able to take their blood pressure, their heart rate, their oxygen level, and knowing what changes need to be made in your treatment based on that patient's vital signs. Since patient safety is our primary focus during treatment, we will also have a concern for safety during practical exams. These will be labeled as critical safety elements, and will be identified on each rubric for practical exam. Because these are of such importance, they will be a pass-fail item on that practical exam that you must complete, or you'll have to repeat the practical. As I stated, these will be identified on each individual rubric, and you can also see a description of critical safety elements in the program policy and procedural manual. Medical errors can occur in physical therapy or at any part throughout that patient's care. Medical errors are defined as either an unplanned or unexpected result to a planned treatment. So the treatment was administered properly, per protocol, per dosage, but there was an unexpected outcome. That is still called a medical error. Or a medical error can occur when it's an improper administration. So maybe the dose was given incorrectly and had an unexpected result, but it has to do with either user or equipment error, something that didn't go according to plan. A sentinel event is death or serious physical or psychological injury of a patient that's the result of a healthcare treatment. A potential sentinel event is a near miss. So no harm actually occurs to the patient, but because of the process or the administration of the treatment, the error could have resulted in injury to the patient. Both of these events, whether the injury is caused to the patient or whether there was a near miss or a potential for injury, will result in a root cause analysis. And now what that is an in-depth investigation of the event that interviews all of those that are involved and the goal is to prevent further injuries from occurring in the future. So whether the process needs to be changed so that there are more safeguards so that there isn't a chance for injury. One main change in surgery is that timeout procedure where the surgical team reviews correct patient, correct procedure, and just takes that time out before surgery begins so that there is not an error and maybe the wrong or incorrect limb is removed if it's an amputation, or the wrong organ is removed. And so again, that's trying from prior errors that have occurred, change the process to prevent future errors. Patients who are less mobile have a higher risk for developing skin breakdown or ulcers, and it is very important for when they are under care within a hospital or a skilled nursing facility that we prevent this potential for skin breakdown. The textbook that is referenced here is your Fairchild textbook, and to look up and review, or maybe put yourself in those positions of prone, supine sitting, and where do you feel bony prominences, because that is an area where the potential breakdown will occur. As we're treating these patients, and you'll see once they enter a facility, the nurse is going to review and look to see if they have, and make sure their skin is intact throughout. But then a sign of looking that there's a potential for a breakdown is if we see redness, or even if the skin is blanched or having a white appearance. How do we prevent the skin from breaking down? Changing positions. The hospital beds also have different ways that they inflate and move the airflow within the mattress to change the pressure. Using pillows. We've already talked about with sideline, putting that pillow between the knees helps to prevent breakdown because of that bony on bone approximation at the knees. So this is an area where we as physical therapists and physical therapist assistants can have a large impact on preventing skin breakdown and for the safety of our patients. So today's lecture on patient safety is complete, and if you have questions, feel free to ask me in class.